Many viruses had affected mankind in worst possible ways in the past. Mainly rabies in 1920s, Ebola in 1976, HIV in 1980s, Ebola crisis in 2014, and coronavirus in 2020. Not long ago, Ebola epidemic has shook the world. And not a month into 2020, a new virus epidemic has started in some Asian countries. A newly identified respiratory virus that causes pneumonia was recently discovered in China. A type of coronaviruses have spread in China and have also been reported in nearby Asian countries, prompting U.S. health officials to start screening passengers coming from Wuhan, China to several airports in the United States. Coronavirus is now a major problem in China and other parts of the world as well. What are coronaviruses? Why China and other countries in the world are so nervous about it? Well, let's get into the video to find out. Welcome to Quantum Shots. What are coronaviruses? Coronaviruses are a group of viruses that cause diseases in mammals and birds. It causes diarrhea in cows and pigs and upper respiratory disease in chickens. But how does it affect the humans? Well, a coronavirus is a kind of common virus that can cause a range of symptoms, including a runny nose, cough, sore throat and fever. Most coronaviruses are not dangerous. Some are mild, such as the common cold, while others are more likely to lead to pneumonia. Coronaviruses were first identified in the 1960s, but we don't know where they came from. The virus gets its name from the crown-like spikes on its surface. Corona is Latin for crown. About 858 people have died from Middle East respiratory syndrome, commonly known as MERS, which first appeared in 2012 in Saudi Arabia and then in other countries in the Middle East, Africa, Asia, and Europe. According to the World Health Organization, WHO, a total of 8,098 people worldwide became sick with severe acute respiratory syndrome, SERS, during the 2003 outbreak. Of these, 774 died. In the United States, only 8 people had laboratory evidence of SARS infection. By late January, there were about 9,720 confirmed cases in China, and the death count is at 213 and rising, according to the official Chinese statistics, but the real number is likely much higher. The virus is spreading even outside of China. Thailand has reported 14 cases of infection. Hong Kong has 8, the United States, Taiwan, Australia and Macau have 5 each, Singapore, South Korea and Malaysia each have reported 4, Japan has 7, France has 4, Canada has 3, Vietnam has 2, and Nepal, India, Cambodia, Germany and the United Arab Emirates each have 1. How does it spread? Well, we do not know all of the mechanisms of spread of the epidemic so far. It is likely spread by droplets and contaminated surfaces, and possible airborne spread, similar to SARS. Coronaviruses in general are spread through close contact, a range of about 3 to 6 feet. The virus is primarily spread through a sick person coughing or sneezing on someone. A person could also become infected through contact with the virus particles on a surface, though it's still unknown how long the new coronavirus can survive on surfaces outside of the body. Prevention measures. One of the simplest prevention measures a person can take is proper hand washing. The CDC recommends that patients with the coronavirus wear a face mask to protect others around them, or at least the people around them, if the patient is not comfortable with a mask. Caregivers or people living in the same house as someone who is sick should also wear disposable face masks, along with gloves and disposable gowns, when coming into contact with the patient's bodily fluids. For healthcare workers in contact with coronavirus patients, the CDC recommends a more specialized type of mask, called N95, one that is individually fitted to a person's face to create a seal and that filters out 95% of particles that are at least 0.3 microns in diameter. A micron is 1/1000th of a millimeter. Cure. There is no vaccine for coronavirus yet. To help prevent a coronavirus infection, you could do the same things you do to avoid the common cold. The National Institutes of Health confirmed that the vaccine development is in the very preliminary stages of research. In addition, the drug company Regeneron is in the early stages of work on a potential treatment for this coronavirus. The company previously developed a similar treatment for Ebola. Let's just hope that the epidemic will be gone as soon as it's been spreading. If you found this video insightful, give us a like and share the video. Subscribe to our channel for more interesting content.